Hello, this is HuBioMed. We would like to introduce our product, ACE airvent RHV, in this video. ACE airvent is a kind of rotating hemostasis valve, called like Y connector, and it has the world's first air vent function. This can remove the air bubbles comfortably during the procedure. And these two products are mini RHV. These are two types, 7 French and 9 French remain in compact size. These products are commonly used in the field with ACE airvent RHV. In this video, we will also introduce the function of removing air bubbles through ACE airvent RHV when connecting 9 French mini RHV. You can see that the air bubbles in the product is removed by just pressing the button. And we prepare to use the red ink to make sure that the air bubbles are injected more clearly. Now, I'm going to press this button to remove the artificially created air bubbles on ACE airvent RHV. You saw the air bubble being removed easily just by pressing the button. The air bubble discharge function can be removed not only when using only one ACE airvent RHV, but also when connected to another Y connector. As I introduced in the beginning of the video, I will connect 9 French mini RHV to the side port of ACE airvent RHV and show you how the air bubbles in the 9 French mini RHV is removed. Yeah, in this case, the air bubble has also been removed. And this time, I'm going to connect ACE airvent RHV to the side port of the 9 French mini RHV and show you how the air bubbles in the 9 French mini RHV is removed. Yeah, you saw the air bubbles being removed easily this time as well. ACE airvent RHV has the function like as an independent movement for first valve, the catheter insertion divider on second valve, and the efficient side port angle, as well the strength of removing air bubbles so that these functions allow to improve the use of ACE airvent RHV. I will briefly explain the function with the video. First, independent movement function on first valve. If 2 or more catheters are inserted into the RHV, it may be twisted when the handle is rotated to open and close the valve of the Y connector usually. This product is designed to prevent the catheter from twisting even when the handle is turned for opening and closing of the valve, so that the catheter is not moved necessarily. Next, the segmentation function for catheter insertion. If you need to separate the catheter during the procedure, this function is designed to make it easier to distinguish which catheter by adding a divider that is easy to assemble and detach if you need to use it whenever necessary. Finally, by efficiently reducing the angle of the Y connector, it makes it easier to enter the second catheter when using 2 or more RHVs. This angle helps to easily enter the catheter, so that increasing the operator's satisfaction. You've seen the function of ACE airvent RHV on video and photos. We introduced many functions of ACE airvent RHV, and we hope they will improve safety and convenience for both patient and operator using ACE airvent RHV. Thank you.